Welcome, everybody. This is Revolutionize Your Marketing by Mill City Marketing MA. My name is Kurt Ruskoff. I am with the World of Ability Podcast Network, and we are pleased, proud, and privileged to be having this programming by John Petros Sr. And this is going to be a show that's all things marketing. And John's got a guest coming on with another angle, another twist and turn and quiver, whatever you may chalk it up to be. It's going to be a great Revolutionize Your Marketing show. John, take it away. This is your show. Have fun.
Thank you as always, Kurt. Hi, folks, and welcome to Revolutionize Your Marketing. Don't mind this. I'm getting ready for Christmas in July. Can't mistake me for Santa Papa John, though, even though my name is John. That's a totally different person who enjoys being Santa all year round. And with me tonight, I have a very special guest. If you have ever had a problem with insurance companies that drive you up a wall, you'll want to pay attention. So let's welcome Mark Rudy. I always pronounce the last name wrong. Welcome, Matt. I can't even talk tonight. Sorry, folks. Welcome, Mark.
Thank you. Thank you. Yeah, a lot of people can't pronounce my name. It's actually Haupt, an old German name.
Haupt.
So Haupt, yeah. But I've been called many things with that name, so it's all right. Thanks for having me, John.
So let's start off and let everybody know what you do and where you're from and how you get to what you do.
Okay. I'm originally from, we moved out here to the Seattle area about mid-60s. So I guess I can say I'm originally from Seattle, and I was in the corporate world for over 30 years. And being in the corporate world, I had the opportunity to move down to Los Angeles and then San Antonio. And then I finished my career in Charleston, South Carolina in the last 30 plus years. So now I'm back to Seattle. And I was sitting around after retirement, played some golf, realized I'm not going to do this the rest of my life. And I was introduced to this company by my sister. And I'm telling you, when I saw it, it just made sense. It gave me a purpose. It gave me a mission in life. And now I'm on a crusade and a movement with this nonprofit healthcare company called Impact Health Sharing. And my story, I think like many other stories, with traditional healthcare, they fool you because you think you're going to get your claims paid, right? You're sick, you go to the hospital, you have these bills, and you pay insurance because you think they're going to pay them, right? Well, wrong. Not always. And we really had to butt heads with my brother's insurance. He was diagnosed with glioblastoma about 7 years ago. And up here in the Seattle area, we did everything we needed to do. We listened to his insurance company, stayed within the network, saw their doctors, did the tests, that he wanted to do, or they wanted him to do. He had a couple of surgeries, like I said, bunch of radiation, and after about 4.5 years or so, the director of the brain center here at the University of Washington came into our room and said, "Sorry, take him home. We can't do anything more for him." And my sister and I were in the room, and with his wife as well, and our jaws dropped. We couldn't believe it. And fortunately for us, we had started sending his medical records out to other brain centers around the country. And he was even willing to go to Europe to see what could be done for him. And it was really hard there towards, during this period, because his brain would swell so much that he wouldn't remember his name. You couldn't communicate with him. He couldn't speak. And so we would rush him in, and they'd give him massive doses of steroids to reduce the swelling. So anyway, when we were told that to take him home, we we were devastated. Fortunately, as I said, when we sent his records out, 2 days later, I got a call from one of the top surgeons at the Ivy Brain Tumor Center in Phoenix. And he said, bring him down. We can help him. We can do surgery. And we got this new chemo drug that we're in a clinical trial with. And it sounds like he's going to, or looks like he's going to qualify for that trial. So we get down there, packed him up, moved him down. 2 weeks it took us to work with the insurance companies to get all the information back and forth. And after about 2 weeks, we got a letter, not a phone call. We got a letter saying claims denied. We will not cover his surgery. We will not cover his care because he's out of network. And we were, again, devastated. So couple of days after that, he got so bad again that we had to go in through the ER. We went in through the ER, and at that time, we found out that the insurance company has to pay because we went through the ER. God above was with us, because it worked out to where, they admitted him. They talked about surgery. We were on the high road again. And day or two before the surgery, guy comes in with the clipboard and says, you don't have insurance. So after the surgery, you got to find a place to go. And it's like, come on, help us here. And luckily for us, we had a really great nurse coordinator, and she kind of kicked him out of the room and said, not now. It's not a good time. So he ended up having the surgery. He started the therapy, the physical therapy, to get better, to take the chemo drug. And unfortunately, he got pneumonia and a blood disease and passed. So we took him down there and we brought him back in an urn, and it was just devastating. So my mission is to share everything I can about this nonprofit healthcare company called, again, Impact Health Sharing. And this company is just amazing. Affordable. People pay less than half of what they normally pay for traditional healthcare. I signed up my doctor, his wife, and their teenage son. They were paying $1,800 a month with Blue Cross Blue Shield, and their policy through Impact was $627. Exactly the same coverage. I mean, it is comprehensive healthcare, just like insurance, acts like insurance, but not insurance. And so I'm doing everything I can to get that word out that this company is growing fast. We call ourselves the decentralized, member-focused approach. And because of technology, this company is quick to pay doctors. They're quick to renegotiate the care, after you see a provider. So it's really exciting to be treated in a way where, they actually care for you. And I'm not saying traditional healthcare companies don't care, but our experiences weren't so pleasant, and it didn't seem like they cared. So yeah, really exciting about this Impact Health.
Yeah, sounds like it's a really good plan. I might have to check it out myself.
Yeah, I'm on it. I'm a senior, and I have it as a supplemental plan. So I pay $96 a month, and for us seniors, there's no pre-existing conditions. So You can sign up with what you got and or who you are and where you're at in life, and they'll take you. So
Hmm.
it's that's nice too. It's very exciting. And what's nice is last year, um, not quite sure exactly how they go about projecting out claims, right? But the owner and CEO, Mr. Phil Chrysler, made an announcement that because of the claims that they had projected to pay, they didn't. They had an abundance of money that, you know, since it's nonprofit, they had to do something with. So they've included a dental and vision plan at no extra cost. So
Oh.
we got Carrington Dental and VSP Vision now included with our medical care. So I
Hmm.
don't think people can go anywhere and pay those premiums with and get and all the things that we get through Impact. So again, it's very exciting, and I want to tell the world.
Well, this is a good place to start.
Right, right, love it, love it.
But so is it just for individuals or
No, actually, what I realized when I started doing this a couple of years ago is, small business owners, let's say 50 or less employees, they want to offer healthcare, to their employees, but they can't because of the cost. And this, as I said, people pay half, if not about 50 to 60% less than what they'd pay with a traditional healthcare. So this is a great opportunity for small businesses as well. Large families get bonus because when I give you a quote, and if you have a family of five, I'm going to give you a quote for a three or more. That's it. So you can have a family of 10, and your
huh,
quote's going to be for three or more. That's it. No extra cost for having a large family. So that's exciting. Um,
yeah.
young kids, in college or just starting out, they're again, it depends upon their age, but they can get coverage for $200 to $300 a month. So, and we have
Yeah.
four different options for your annual deductibles. And what's really cool, I don't think any other healthcare company is doing this. Um, if you are purposefully being healthy, go to a gym, take supplements, um, go to a naturopathic doctor or a practitioner. You take $150 of those receipts every month. You turn them into Impact Health, show them the receipts every month, and they take that $150 off of your annual deductible. So our
Huh.
lowest deductible is $2,500 a year. That's the lowest deductible. Of course, when you have the lower deductible, that's the higher premium, and then vice versa,
Yeah.
higher annual deductible, the lower the monthly. Anyway, you deduct that 150 off. Let's say the 2,500. You're going to have a deductible. We call it personal responsible. Yeah,
It's a Friday.
yeah. It's the same as deductible. And subtract it off of the annual, and you got $700 a year to pay for your deductible, and it's for family, not individual. So you
Hmm.
got your family all contributing to that uh, personal responsibility, yeah, to pay. So it's nothing but goodness. So
So as
oh,
far as
and
yeah,
I was going to say, and sorry to cut you off, and the providers love it because they get paid within 12 to 15 days. And what I'm hearing from the providers is they actually get paid more in some cases
hmm,
than they would get paid from a traditional insurance carrier. So again, all goodness for everybody all around.
I might have to bring it up to my doctor when I go see him in a few months.
Yeah, yeah, yeah.
Wouldn't be
It's
the
it's
first
good.
lead I give him.
Right.
He's too
And
busy taking care of people to check things out.
right, right. Yeah. Oh, I saw a video on TikTok not too long ago. This doctor was on there, and she was complaining about. I'm not gonna mention the health the uh, insurance carrier's name, but she was told from this carrier that if she was talking about doctors in general, if they recommend a test or a procedure, um, and if it's not approved by the insurance company, that doctor working for this insurance company is going to call the requesting doctor. But this doctor from the insurance company is not going to tell them when they're going to call, or they're not going to tell them what number they're calling from. So this doctor on talk says, if you're treating patients and if you get a phone call that you don't know who it's from or don't know when you're going to get it, you're not going to answer it because you're seeing patients and that person's not going to be, approved for the procedure. And I thought that was crazy. I don't know. I wouldn't understand. I don't understand why insurance company would do that. But that's on TikTok. Anyway,
Yeah, that things like that happen occasionally with different businesses besides doctors.
yeah, yeah,
For
very true.
example, we brought our car over to a special electrical place, figuring we
Mhm.
could sit there and wait while they check out the car. They don't let anybody wait while their car's getting worked on.
So you have to find some place to go.
Find someplace to go or
Oh,
drop the car off and then come back to pick it up when it's done.
well, that's interesting.
Granted, it may take a while to do an electrical
Yeah,
thing to find out where the problem is, but even
yeah,
even still, every other mechanic I know of lets you wait.
right. Yeah,
This place,
you would think it would be there to the. It would you think it would be there to their advantage because if they had any questions or if there was something else that popped up while they were taking a looking at it,
yeah,
they could just walk into the waiting room there and talk to the owner. You would think it
yeah,
would be to their advantage.
you would think, but not this place.
Oh my gosh, that's crazy.
So
Crazy.
doctors aren't the only ones that do that.
Very true. Very true.
But so
Yeah.
for businesses, is there a limited number of employees to put a plan together?
No,
So
they have group. Yeah, Impact has group plans, um, and it's really kind of cool because the employer doesn't have to commit to anything. Because the rates are so low, the employer can choose to pay some of the premium or pay all of it, or pay none. It's nice that he's going to just or she's
hmm,
going to be able to just offer it, to the employees.
yeah,
So yeah, so it's really exciting. And I'm telling you, I have one business partner who deals strictly with businesses. That's and the larger businesses. He's even signing up larger businesses for
hmm.
impact, and he's busy. He's busy a lot doing signing them up. So yeah, it's just getting the word out. So
Now, does it do prescriptions as well?
yes, yeah, they have a wholesale prescription plan that was really kind of cool. And this even happened to me. I was guessing it was like a sinus headache infection type thing. So I got on in my account, and oh by the way, you have unlimited telehealth medicine too. So I got online, made an appointment with a doctor. 15 minutes later, a doctor I chose for the doctor to call me. She called me up. We talked about my symptoms, and she said, "Okay, it sounds like you got sinus infection. Where should I call in your antibiotics?" And I said, "Just a minute." I got into my account and I looked on the prescription portal, and I looked at the different prices the drugstores have for this one particular medication. And I told her to, you know, call in over here at this local CVS because they had the cheapest price. So, I mean, that's really cool, you know. And that's why we call it like a decentralized health, right? Because everything is, you know, available to you and not hid away in some, you know, corporation that, you know, you can't ever see. So
Yeah.
very fun. Very, I
That's
mean,
like with
I've,
that's like with the eye doctor that I have. They have somebody right there in the office that sells glasses.
mhm,
I take my prescriptions and go to Walmart's because it's cheaper
right.
and
Yeah,
get them there.
right.
Um,
Exactly right. I mean, and what's nice is, you know, with the artificial intelligence that Impact uses, I mean, they have all the latest and greatest information, you know, and again,
right.
that's how providers get paid in a timely manner. They, you know, they get back to the doctors to reprice, and I've been told that almost 80% of whenever a provider submits you know, a payment claim for payment, Impact comes back and does like a repricing thing. And I've heard lately 75 to 80% of the time doctors and, you know, the providers accept that payment the first time. They don't have to go back and forth and negotiate, because so that tells me the providers are more than half, or more than 75% of the providers are happy with, you know, the client, with the payment that they're going to receive the first time, which that's kind of out of my league because I'm, you know, I don't know too much about that, but that's pretty amazing, you know, where, and they get paid within 2 weeks. I think I mentioned that earlier, which I, I'm told is unheard of in the traditional health world. So,
Yeah. Before I forget, why don't you let people know how they can get a hold of you for more information?
yeah, can definitely email me. And my email is my initials, Mark Rudy, and then my last name, Haupt at yahoo.com. And then my phone number is 843-327-8422.
Man, how long have you
Oh,
had that email?
I'm
How long have
sorry.
you had that email? How long have you had that email?
Uh, gosh, I've had it probably 5, 6 years, I think, something like that,
On
or
Yahoo?
more.
Wow, I would thought it was like 30 years old.
No. This is the newer account. I do have an older account about 30 years old,
I'm gonna say my first
but I
Yahoo account was like 1990 something, and it was like Big Mac Daddy 1206 at yahoo.com.
yeah, yeah,
That's when Yahoo Messenger was out. It was like right
right,
next to, right after, right around AOL.
right, exactly. That's funny.
That's when you used to turn your computer on at 9 o'clock in the morning and you get to your homepage by 3.
Right.
Do you have any
Exactly.
questions for him, Mark?
Uh, Myself, well, the fact that it's a nonprofit, I would love to encourage him to look into Inspire.world, because Inspire.world, it will help him raise funds for the you know, the organization itself, you know, and give them more financial impact on the world. You know, where, I mean, right now it's in North America, but it'll soon go international, and it'll give a company like this opportunities to raise more funds and raise more money at no cost whatsoever. And if they decide to go something like swag or a website, or people can go to the website, if people are finding this website to be that impactful, and this to be that impactful, then they can, you know, buy stuff, and they can sell T-shirts and hats and different things on their website. And there's no cost to them about the product. There's no cost about the swag, and they just make money. So he should definitely look into it. If he brings Inspire.world, because he sounds like he's an affiliate. So if he goes in, I'm sure he's just I mean, no offense, but I'm sure you're an affiliate.
Yeah, yeah,
Hearing how you speak. And so the owners themselves, if you brought this inspired.world to them, you would look like a hero. And if you use me as a referral, and you can see it right behind me, it's an outstanding organization, and me and Kurt are very much behind it, with a gentleman named Daniel Barrett, and then the people themselves that own this company can go directly to Daniel and talk directly to him.
Right. That's a good plan. Absolutely.
Yeah, it's inspired.world. And by the way, you can use it, both you guys can use it personally. It doesn't have to be a nonprofit organization, a school. It doesn't have to be anything. You can be personally, and you guys can put money towards what, like cancer research, or like things that, like, there should never be a situation where your family went through that. My wife contracted cancer back in June. Luckily, you see, there's a difference. Like, the hospitals are screwed up. There's no doubt about it. Okay. My wife's been a nurse for 30 years, now 20 years in numerous hospitals out here in Phoenix, like PCH and Banner. And I know it firsthand, and so does she. And medical insurance doctors don't fix things. They just, make it to where it's less painful so they can charge you more, so you can keep coming back. And that's a true story. I know it firsthand. So, but when my wife contracted cancer, with her reputation in Arizona, when she showed up at Mayo Clinic and she showed up there to take care of business, they treated her like a VIP because she was part of the system. And because she had 30 years as a nurse and a reputation as she did, and because she's ECMO, CRT, and how many people she's helped over the years, how many cancer patients she helped over the years, they took extra special care of her and gave her VIP treatment all the way across the board. And so yes, there's yes, I saw it firsthand.
Yeah, so you know what I'm talking about.
Yeah, and they cured her cancer. Yeah, the doctor. I literally went on June 15th on June 18th when we went into surgery. I sat there first thing in the morning with him, and I looked the doctor straight in the eye. And I says, "You do realize, okay, who she is and what she does?" And I go, "You better make it go away." And I says, I looked at him and I says, "You really better make it go away." And he goes, "Mark, I got it." And
Nice.
6 months later, he was cancer free. So, yep, I told that doctor, "You better make it go away, or I might be calling some of my friends from New Jersey in on a picture." Yeah, so he took me very seriously.
That goes to show you that doctors can cure things and not just
100%.
cover them up.
100%. They're a miracle.
Absolutely.
They're taught to fix you, but the insurance companies and the hospitals tell them different. But they're taught to fix you.
Well, and that's what I don't understand. I mean, I hear stories all the time about a good friend of mine. His wife had this defective heart valve since, birth. And she just waited a few years ago. Her cardiologists have always said, eventually you're going to have it repaired, going for blah, blah, blah. Right. So about a year or so ago, it was time. Well, my friend and his wife went to their health insurance company, and their health insurance company, guess what they said? "No, we don't think you need it right now. We're going to wait." It's like, come on. So case in point, right? To you, Mark, it's they don't know, and they shouldn't be dictating that. That's what's the frustrating part is.
Yeah. It's like my mother had some medical issues, and she knew herself when she was having congestive heart failure. And her room was downstairs, our room was upstairs. So we got one of those little battery operated doorbells, and we put the bell up in our room.
Okay.
And anytime she felt it coming on, she'd push the button. It would ring upstairs, and we'd come down and help her, or if need be, which sometimes didn't need to, we'd call an ambulance, come take her to the hospital. And it was like 5-6 times that she came out of it. And we had plans to go away one time. We weren't going to because of her medical issues. And she insisted that we did. And she was actually in a rehab at the time, which
Hmm.
around here at that time they were at nursing homes,
Right, right,
and we had a hard time to make her understand she wasn't going into a nursing home. That wasn't ever going to happen
right,
if she was just in there for rehab.
right.
And we went up into New Hampshire for a week in a place that, yeah, cell phones didn't work too well. We went to leave, and my phone lit up like a Christmas tree. Everybody trying to get a hold of us. They knew where we went, but while we were gone, she went into congestive heart failure at the nursing home and ended up dying.
Oh, sorry to hear that.
And so we rushed back. And a couple of days afterwards, I was in there letting that nursing home know that, hey, yeah.
Yeah, yeah,
Because,
yeah.
I mean, we saved her 5, 6 times, and you guys are educated for this stuff, and you couldn't.
Right. Yeah,
But
yeah.
yeah,
It's terrible. That's not good news.
it's like you guys are supposed to be watching and taking care of her. What happened?
Right, right.
We were doing
Hmm.
a better job with her at home. But
Right.
let's bring Kurt in and see if Kurt has some questions. I know he comes up with good questions. He's been doing this longer than me. There he is.
All
Hey,
right.
Kurt.
Hey, Rudy. Now you go by Rudy, right? It's not your middle name. You go by, or is it both?
Well,
Is it both your
it's
middle
funny,
name
yeah.
and?
Amen. Heal
No,
up here.
no, no. A lot of people call me Mark Rudy. A lot of people call me Mark. A lot of people call me Rudy. So it's like
You call
my
me Mark,
nickname.
and you
That's
can
my
call me Rudy, and you can call me MRH, or you can call me Mark Rudy Haupt. Wasn't that a Gong Show comedian?
exactly. Yeah.
That was
And
a
I've been
Gong
called
Show
a lot
comedian.
worse. So
Mark, or you can call me Johnson, or you can call me John J, or J. We're all old. We know. I still, we're all old. We know what Gong Show was.
yeah, exactly right. I answer to both. How's that, Kurt?
There you go. Sounds good. So, so let's dive in again to, we're talking a lot about doctors and cancer and the allopathic medicine. What can we say for, impact health sharing as far as the, nutraceuticals, pharmaceuticals, and the naturopathic medicine? Like, what's the scope of this? What is the company trying to do, making different options available for the patients?
Oh gosh, that's a good question, and it's never been asked to me before, to tell you the truth.
Leave it to Kurt.
Yeah. I've got to find out that answer. I can't answer that honestly, Kurt. I gotta dive into it. I know they're just really they focus on making it affordable, making it decentralized, to where you see everything in your account. You see who you're sharing with, you see who has shared with you. So, I mean, um, and I'm sure, but I gotta find that answer, because I'm sure they're being proactive in and doing, and taking some preventative measures. And I'll get back to you, because I'm going to ask that question myself for sure. So.
Okay, so you would have to include in that question about chiropractic, or do you know about chiropractic being covered
Yeah,
somehow?
you get visits. You get I think it's I think it's 50 visits, if I'm not mistaken, of chiropractic care.
Okay, great.
Yep, yep, yep.
Yeah, and then
And
there
a lot of
must.
what I'm sorry, a lot of the I was going to say, a lot of the naturopathic practitioners, they don't accept insurance. So, but Impact works with the naturopathic, folks, the practitioners. So that's a good fit, in my opinion. They're a good fit, because basically Impact Health is for the healthy, I saw some statistics where there's 5% of the folks that really do need traditional health insurance because of their illnesses and their, whatever they have, right? 95% of the people are paying, on traditional health care. They help subsidize the cost by having their premium so high is what I read. So anyway, so for the healthy,
And
sure.
then there is a pharmaceutical discount plan. Is that part of the
Yes,
membership benefits?
exactly right.
Yeah.
And you can find, you get the name and address of where the pharmacy is that has that cost, because I did not know it until I kind of dove into this, where a pharmacy on one corner can be X price, and then across the street it can be $20 higher. I did not realize that. But with their artificial intelligence, Impact is able to, has all those, has everything in their system, all those prices in their system and where to get them. So that's a good thing.
So, and then do you know, like in terms of like vitamins and stuff like that, like is there some sort of a discount plan for some of those type of health products?
Not through Impact. No,
Okay.
not through Impact. Yeah.
Okay, interesting. And then you come into Impact Health Sharing through a larger consumer organization, right? That it's that there's a larger corporation behind it that's been making a name for themselves for decades about, shaving residential costs and, kind of doing the, economy of scale aspect that you can be a part of the organization. And, there's other products that the larger organization is working with to save on things on the other side of what the company does, right?
Exactly right. Yeah. Impact partnered with direct sales company called All Communications Network, ACN. And what you're referring to is the other services, other companies that they partnered with. Example being home security, they partnered with Vivint. Direct TV, direct streaming, they partnered with, direct TV. So yeah, they partnered with T-Mobile. We actually have a subsidiary called Flash Mobile, but again, partnered with T-Mobile for those. So yeah, and you and it was very smart that they've done that, because ACN, they put this platform together that connects you right directly with these corporations, and a lot of times you get better value by signing up through ACN with these other companies. So I found that to be really intriguing. And oh, by the way, you pay your bill and you get a residual check. You sign somebody up and they pay their bill, you get a monthly check coming in, a residual check. So I mean, that's how that's marketing company works. I thought, well, let me see. Everybody's got to pay bills, and why not get a check when I pay my bills? Why not get a check back? So that's why it made sense to me. So much sense to me. So
All right, excellent. So folks kind of leaning into this and really liking what they're hearing today, and to keep the journey going and to learn more, is your team doing like events, like other Zoom events where folks can come on
yes,
and get more of the rundown and more of an informational session on what's all behind it?
absolutely. Yes. ACN.com. We actually have a large all company. I'll tell you what, these four owners, I have never seen a direct marketing company like this in my life. These four owners, co-owners, care about the people. They could be raking in all the dough, right? But they keep signing up more businesses. They keep, upping the residual plan. I mean, they want to share the wealth, and so they're having a huge event tomorrow. You go to acn.com and there's live events all over the nation and up in Canada. So
Yeah,
Yeah,
and
good
if
question.
yeah, so on the ACN, the broad scope of things, with the communications and everything. But if somebody just really wants to stay in a session that is just helping them, feel comfortable with what they might do with impact health sharing, um, is there like there's a separate session that'll just be on the health benefits?
Yes. Yep. Yeah. We have a demo. We actually demonstrate how the system works. Schedule changes sometimes, but usually 3 times a week. And I can provide that link to whoever is interested. Um, you know, that wants to see a deep dive on how Impact Health System actually works. Good question. I forgot to mention that.
All right.
I can,
Excellent.
if I can step in for a second, I just went to their website under the pricing, um, asks for date of birth,
Yep.
and it actually says anybody over 65 has to apply as an individual.
Right. Yeah. As a
Um,
supplement. Yeah. And you have to have Medicare A and B, parts
yeah,
A and B.
I
Yeah.
came up with $1,000 responsibility for $96 a month,
That's what I pay.
which isn't bad.
Yeah. Yeah. Really can't beat it, and
Yeah,
especially, and what I love is the telehealth. You're sick in bed, don't want to see anybody or go anywhere. Heck, get online and see a doctor, unlimited visits with the telehealth. That's just makes sense to me,
yeah.
and then have the medicine delivered to your door. Pick a pharmacy that has the medicine delivered. You don't even have to leave the house. So that's what I like about it.
Now, I have a question for you on that. Would that replace the insurance that someone would get charged on Social Security?
No, you still have to have A and B. Well, yeah, to sign up for Impact Health as a supplemental plan, you have to sign up for Medicare Parts A and B.
Yeah.
And then you can use that separate plan as your supplemental. The 20% that Medicare doesn't pay, that's what Impact picks up.
Yeah. Because the reason why I'm asking is because I have Medicare A and B,
Yeah.
and my Social Security check that I get, they also
Mhm.
take out I think, 100 and something dollars a month for
Yep. Mine too.
for backup coverage. Would that replace that backup coverage?
I don't believe so. I mean, because for me, they take out 180, and I'm paying that fee is for parts A and B. So so in essence, I'm paying, Medicare parts A and B, and then another $96 as my supplemental plan.
Okay.
Yeah.
Just asking.
No, you never know unless you ask, right?
All right. Any other questions for him, Kurt? Oh, one thing I did want to mention. Um, how does it work for people in that have been in the military?
That's a good question. I knew a lot or know a lot of veterans when I was down in Charleston, and a lot of the veterans that I talked to are pretty happy with the VA. As we know, it's no charge to them to use the facility, um, but some veterans aren't, and so this, you know, and only because it takes them a while to get in, for an appointment, or they want to see a specific doctor, and sometimes the VA doesn't refer them, or whatever. So this is a really good option for them. Just sign up. If they're 65 and over, then yes, they have to, make sure to, have the parts A and B, and then they get The max monthly amount that a senior pays is $146. So it goes from, I think, 89 to 146, and that's the max you're ever going to pay as a senior. So if the veteran is a senior, then that's what they can expect to pay in between that range. So, but yeah, it's a great supplemental plan, and even for the family, if a veteran's if a family from a veteran wants more options, then Impact is a good source because of the no provider network, or no network provider, I should say.
Okay. You look like you have another question ready, Kurt.
No, I think we're good. I think that's been a seemingly pretty thorough review of Impact Health Sharing and ACN and opportunities to continue the journey. So I think we did it today.
All
I
right.
really appreciate you guys having me on. I can't thank you enough. My whole goal is to get the word out there for folks, because I know a lot of people that are in the corporate world and want to start up a business, but are afraid to start up a business because they don't want to lose their health care and all that kind of stuff. Impact Health is a great option for them, affordable. So anyway, thank you again. I really appreciate it, guys.
No problem. Take another few minutes and let people know once again how to get a hold of you.
Okay. You can reach me with email, and it's again MR, my last name HAUPT at yahoo.com, and then phone number 843-327-8422.
There you have it, folks. If you want to change insurance companies, there's a great alternative here for you. Thank you for coming on, Mark. And
thank you very much. Really
we'll
appreciate
support
it.
you any way we can.
Thank you, John. Thank you, Kurt.
I will be talking with you. I have an idea for you.
All right. Thank you now. See you, Mark. Bye now.
Bye-bye. And there you have it, folks. Another one in the books. I do have a guest for next week. It is Dr. Janet, is how she's known. She's on Lineable, Kurt. She's very well known on Lineable. She has a Christian counseling center. We'll hear more about what she does next week. So stay tuned. As always, if you want to see any of my previous podcasts, feel free to go to YouTube and type in Mill City Marketing MA or Revolutionize Your Marketing. And most of them will come up there. Take us out, Kurt. It's all yours.
All right. Thanks, John. Great show. Great guests. We're looking forward to next week. We're always here, as stated, 5 p.m. Eastern every Friday. Let's keep doing it. Revolutionize your marketing.
Every Friday except after next week.
Oh,
Friday
because
is
the
the
4th of July. So we will be having a 4th of July holiday break from the show. Okay.
Take care, folks.